Welcome to Outbreak Brief, the podcast that takes you inside the world's most dangerous infections.
And this one is a truly fascinating target.
Yeah, today we are doing a deep dive into a stealthy, incredibly resilient pathogen that, well, it goes straight for your liver. It's an invader that hides in plain sight, setting a trap for weeks
Yeah.
before its victims ever feel a single symptom.
Right. It's basically a masterclass in evolutionary survival. I mean, we spend so much time worrying about respiratory viruses, right?
Yeah.
The kind that announce themselves with a cough or a high fever almost immediately.
Exactly.
But this pathogen, it operates on a completely different, much quieter timetable.
Yeah, and to really understand the sheer scale of what this microscopic threat can do when that timetable finally runs out, we need to bring you back to 1988. The city is Shanghai, the winter is just ending, and in the span of literally just a few months, roughly 300,000 people suddenly fall violently ill.
Which is an astronomical number. The hospitals were completely overrun. We are talking about severe, acute liver inflammation paralyzing a massive urban center. I mean, factories literally ground to a halt because there simply weren't enough healthy adults to run the machines.
300,000 people. Like, for you listening, imagine the entire population of a modern city the size of Pittsburgh suddenly coming down with severe liver failure, all at the exact same time.
Yeah, it's staggering.
And the catalyst for this massive medical disaster, it wasn't some engineered bioweapon. It was a batch of clams. Clams harvested from heavily polluted waters and then just consumed by the general public. We're talking about the Hepatitis A virus, or HAV.
Right, and the Shanghai epidemic perfectly illustrates the defining characteristic of hepatitis A, which is its sheer environmental resilience.
Right.
This is a virus that can survive in soil, it can endure freezing temperatures, and, persist in marine life for months. It just waits, and when a population finally encounters it, it has the capacity to erupt with just terrifying speed.
So let's unpack the biology of that resilience. What exactly are we dealing with at the microscopic level here? Our sources classify HAV as a positive-sense, single-stranded RNA virus from a family called Picornaviridae.
Yes.
But, what does positive sense actually mean for the person who gets infected?
So think of a virus as a set of malicious genetic instructions. Now, many viruses have to actually carry their own tools to translate their code into a language our human cells can understand, right, before they can start taking over.
Okay, so they bring their own translation manual.
Exactly. But a positive-sense RNA virus doesn't have to do that at all. Its genetic code is already formatted exactly like our own cellular messenger RNA.
Wait, really?
Yeah. So the moment it slips inside a human cell, our own biological machinery just immediately reads it and starts mass producing the virus. It's essentially like a pre-compiled software program ready to execute on contact.
That is terrifying. And amazingly, humanity didn't even know what this highly efficient software looked like until 1973. It was finally identified using this thing called immune electron microscopy.
Which is just a brilliant technique because, viruses are often way too small to see clearly, even under standard electron microscopes.
Right.
So what scientists did was they took antibodies, which are the proteins our immune system makes to latch on to specific threats, and they mixed them with stool samples from infected patients.
Okay.
And those antibodies clumped the hepatitis A viruses together into larger clusters, which finally made them visible to the microscope for the first time.
Wow. And when they finally got a look at it, they realized its evolutionary lineage is super ancient. It shares roots with insect-infecting viruses and traces all the way back to bats and rodents. But here is the detail from the deep dive sources that completely blew my mind. This virus has a dual nature. It literally changes its physical structure depending on where it is in your body.
Yeah, it's wild.
When it's in your bloodstream, it's considered quasi-enveloped, meaning it has wrapped itself in a stolen piece of your own cellular membrane to hide from your immune system.
It's a phenomenal disguise because, your white blood cells patrol the bloodstream looking for foreign invaders, right?
Right.
But because the virus is wearing a coat made of your own cells, it just slips right past the guards.
Okay, but the sources say that when the virus exits the body in human stool, it's a naked virion. It has no envelope at all. So how is a microscopic piece of RNA managing a wardrobe change.
Well, it's less of a conscious decision by the virus and more of a brutal exploitation of human anatomy.
Mm.
So the virus replicates inside your liver. When it exits the liver cells to spread through your blood, it tears off a piece of the cell membrane to use as that disguise.
Oh, wow.
But the liver also processes bile, right, which is released into the digestive tract to help you digest fats.
And bile contains bile salts,
Yeah.
which basically act like a digestive detergent, right?
Precisely. So a portion of the newly replicated virus gets pushed out of the liver directly into the bile ducts. And as it travels down into the intestines, those bile salts chemically scrub the stolen cellular membrane right off the virus. It literally strips the disguise away.
So it uses our own digestive detergents to strip down to a naked virion. But wouldn't losing its protective coat make it, weaker?
In a fascinating twist, it actually makes it much stronger.
Wait, how?
Well, lipid envelopes, like the one the virus wears in the blood, are actually quite fragile outside the body. They break down really easily when exposed to alcohol or heat or environmental stress.
Okay.
So by letting our digestive system strip away that fragile lipid layer, the virus is reduced to a microscopic protein-armored tank. And that is exactly why it survives for months in freezing water or soil.
A protein-armored tank. Since it is so perfectly armored to survive outside the human body, it makes total sense that our history with hepatitis A has mostly been a battle over environmental control and sanitation.
Yeah, exactly.
Because in the late 1990s, we developed highly effective inactivated vaccines, and the data shows cases plummeted by 90%. It really seemed like we'd have won.
We thought we did.
But then, starting in 2016, the United States saw a massive, deadly resurgence. Over 44,000 reported cases and more than 400 deaths. If we had a working vaccine, why did we suddenly lose control?
Because the demographic profile of the victims shifted entirely. Historically, U.S. outbreaks were foodborne, like the Shanghai clams or contaminated green onions imported from regions where the virus is highly endemic.
So the general public would just get sick from a grocery store purchase.
Exactly. But the 2016 surge wasn't driven by food at all. It was driven by direct person-to-person transmission within populations that had largely fallen through the cracks of the healthcare system.
We're talking about people experiencing homelessness, people who use injection and non-injection drugs, and individuals lacking access to basic sanitation or routine medical care.
Yeah, and crucially, these were populations with very, very low vaccination rates. So when you combine a highly contagious environmental virus with a lack of access to clean water and routine health care, you create the perfect biological kindling for a localized epidemic.
Which brings us to the actual mechanics of how this pathogen moves through those communities. The clinical term is the fecal-oral route, which is as unpleasant as it sounds.
Very unpleasant.
It means an uninfected person is ingesting microscopic amounts of the virus that was shed in the feces of an infected person.
And the scary part is it takes an infinitesimally small amount of the virus to trigger an infection. And because it lacks that fragile lipid envelope, as we discussed, it survives on doorknobs, shared items, handrails for incredibly long periods.
But to me, the real terror of hepatitis A is its timeline.
Oh, absolutely.
The incubation period, the time between when you swallow the virus and when you start feeling sick, is typically 14 to 28 days, and sometimes it stretches up to 50 days. And the most dangerous phase of the infection happens entirely in secret.
Right. That is the nightmare scenario for epidemiologists. An infected person sheds the highest, most concentrated amounts of the virus in their stool up to 2 weeks before they experience a single symptom.
Like a ticking time bomb, where the saboteur plants the device and walks away a full 14 days before the explosion. You're walking around your community, touching surfaces, preparing food, interacting with people, and unknowingly leaving a trail of armored viruses everywhere you go.
Exactly.
By the time you finally feel sick, you've been contagious for half a month.
And because it's so hardy, it survives standard pasteurization processes and low pH environments, it just moves silently through a community until suddenly emergency rooms notice a massive wave of patients turning yellow.
Yeah.
And when that wave hits the hospital, the outcomes are drastically different depending on the age of the patient. This was one of the most counterintuitive details in the research for this deep dive.
Yeah.
If a toddler encounters this virus, they often show zero symptoms. You wouldn't even know they were sick. But if a 40-year-old adult catches it, they face a high risk of severe complications, including acute liver failure. Why is an adult body faring so much worse than a toddler's? Well, it comes down to a tragic irony of our own biology. The hepatitis A virus itself does not actually destroy your liver cells, it just uses them to replicate. The destruction is entirely caused by your own immune system.
Our body is essentially burning down the house to kill the intruder.
That's the exact mechanism, yes. A toddler has a relatively immature immune system, right? So it mounts a mild response, clears the virus quietly, and leaves the liver mostly intact.
Okay.
But a healthy adult has a highly developed, aggressive army of T cells. When those adult T cells detect that the liver cells have been hijacked by the virus, they launch a massive scorched earth attack.
Oh, wow.
Yeah, they literally obliterate the infected liver cells to stop the viral replication. And that overwhelming crossfire is what causes severe liver inflammation and potential failure.
So the virus just lights the match, and our adult immune system supplies the dynamite. So what does that internal war actually feel like for the patient? The clinical progression usually starts with the prodromal phase. You develop intense nausea, overwhelming fatigue, a fever, and a very specific pain in the upper right quadrant of your abdomen.
Right, and that pain is actually the physical swelling of your liver stretching the protective capsule that surrounds it.
Ugh, that sounds awful.
Yeah.
And then, usually about a week later, the hallmark visible signs appear. Jaundice, the yellowing of the skin and the whites of the eyes occurs in up to 80% of adults.
Mm-hmm.
Then there's dark brown urine, which affects up to 94% of patients, alongside stools that turn a pale clay color. I was trying to conceptualize this, and it feels like the liver is acting like a municipal water treatment plant that has suddenly gone offline.
The water treatment plant is a highly accurate way to visualize it because your liver is responsible for processing a substance called bilirubin. Right. And bilirubin is a yellow pigment that forms naturally when your body breaks down old, dead red blood cells. Normally, the liver filters this yellow pigment out of your blood and deposits it into your intestines, where it exits the body in your stool. In fact, that pigment is actually what gives human stool its normal brown color.
But because the liver is inflamed and under attack by our T cells, the treatment plant shuts down.
The plant shuts down completely, and the bilirubin has nowhere to go. So it backs up into your bloodstream, which literally dyes your skin and the whites of your eyes yellow.
Wow.
Then your kidneys panic and try to take over the filtering job as a backup system, which turns your urine dark brown. And because the pigment is completely blocked from reaching your intestines, your stool comes out pale and clay-colored.
It is such a visceral set of symptoms, like it's draining the color from inside you and pushing it to your skin. And for some people, the backed up chemicals cause cholestatic hepatitis, where bile acids seep into the skin and cause an intense, maddening itchiness.
It's terrible.
Some patients even experience relapsing infections where they think they're recovering, only for the symptoms to come roaring back in cycles that can drag on for 12 months.
Yeah, it's an agonizing experience. And honestly, the most frustrating part for the medical community is how little we can actively do once that process starts.
That was the hardest truth in the source material for me, because we live in an era where we have miracle antivirals that can cure hepatitis C. Yet, for hepatitis A, a virus that incapacitated 300,000 people in Shanghai, the standard medical protocol is essentially drink fluids, rest, and hope for the best.
Pretty much.
Why do we have no specific antiviral treatment for something this dangerous?
Well, it's the timeline of the infection that dictates our limitations here. Hepatitis C is a chronic infection, right? It persists for years, which gives our antiviral drugs plenty of time to locate and dismantle the virus. But hepatitis A is acute. Because of that long incubation period we discussed, the virus spends weeks quietly replicating. By the time the patient turns yellow and feels sick enough to seek medical help, the viral replication has actually already peaked and begun to drop. The bomb has already gone off.
So an antiviral wouldn't even help because the virus is already leaving the building.
Yeah.
The damage is done, and it's just a matter of waiting for the liver to regenerate.
Exactly. And ensuring the patient doesn't accidentally make it worse, we have to keep them away from absolutely anything that taxes the liver. That includes alcohol, obviously, but also really common over-the-counter pain relievers like acetaminophen.
Because acetaminophen is processed by the liver.
Yes, and taking Tylenol when your liver is actively inflamed by hepatitis A is like throwing a bucket of gasoline on a house fire. It can rapidly push a patient into acute liver failure, or ALF. And if that happens, the patient requires intensive care. The liver stops filtering toxins, leading to brain swelling. It stops manufacturing clotting factors, leading to severe internal bleeding, which is known as coagulopathy.
And at that stage, you're just frantically trying to keep them alive long enough for a liver transplant.
Essentially, yes. There is some anecdotal evidence for using corticosteroids to suppress the immune system in severe relapsing cases, but it's really a last resort.
So since treatment is basically just holding the line, prevention becomes the entire focus of public health. Now, if you happen to catch the virus naturally and survive, your body develops a rapid IgG antibody response. These are long-term memory antibodies that grant you lifelong protection.
Mm-hmm.
But relying on natural infection is obviously a massive gamble.
A gamble we no longer have to take, thankfully, because of inactivated vaccines like AGVRX and VQDA. They're recommended for children between 12 and 23 months, and for all the high-risk adult populations we discussed.
But our deep dive sources highlight an incredible secondary use for the vaccine, post-exposure prophylaxis, which means if you find out you've been exposed to hepatitis A, say you ate at a restaurant where an outbreak was just declared, you have a strict 14-day window to get the vaccine.
Yes, exactly 14 days.
Is the vaccine essentially acting like a race car, rushing to build antibodies to beat the virus to the liver?
It's less of a race and more like building a barricade. When you swallow the virus, it doesn't just teleport to the liver. It has to establish itself in the gut and slowly multiply during that long incubation period.
Okay.
So when you get the vaccine within that 14-day window, you're sounding the alarm early. Your immune system rapidly builds a wall of antibodies.
Yeah.
And because the virus is taking its time, those newly minted antibodies can intercept and neutralize the virus in the bloodstream before it ever breaches the liver.
That's incredible. The sources also mention immune globulin for people who are older or immunocompromised.
Right. Immune globulin is a masterstroke of medical cooperation. It's a concentrated solution of pre-made antibodies harvested from the blood plasma of thousands of human donors who already have immunity.
Oh, wow.
So if a patient's immune system is too weak to build its own barricade in time, we simply inject a ready-made barricade directly into their muscle. It provides instant, though temporary, protection.
But post-exposure injections are the very last line of defense.
Oh.
Keeping this virus contained requires massive structural shields. On an individual level, it requires rigorous hand washing. And we are talking about friction, soap, and warm water.
Yeah, this is important. Hand sanitizer is largely ineffective against hepatitis A.
Really? Why?
Remember how the virus sheds its lipid envelope in the gut?
Yes, the naked virion.
Right. Well, alcohol-based sanitizers work by destroying lipid envelopes. Since hepatitis A doesn't have one when it's on your hands, the alcohol does almost nothing. You need the physical scrubbing action of soap to manually lift the armored virus off your skin and wash it down the drain.
Wow, so hand sanitizer is useless there. And beyond the bathroom sink, we rely on this massive hidden infrastructure, municipal sewage treatment to keep our water clean, the deployment of CDC disease intervention specialists who act as epidemiological detectives, tracing every contact of an infected person, and the continuous surveillance by the World Health Organization. Like, preventing hepatitis A requires a globally coordinated effort. It's not just personal hygiene.
Not at all. The virus is the ultimate stress test for a society's infrastructure. In environments where sanitation and public health surveillance are robust, the virus is kept at bay. But where those systems fail or are underfunded, the virus immediately exploits the cracks.
Which gives us a very complicated picture of where we are today. Domestically, the CDC reports that newly reported HAV cases dropped by 28% between 2022 and 2023, which on paper looks like a huge victory.
It does.
But it masks severe inequities. For instance, the rate of infection among Hispanic people in the U.S. is currently twice that of non-Hispanic white people.
Yeah, and the global divide is incredibly stark, too. We categorize the world into different levels of endemicity. In high endemicity regions like parts of sub-Saharan Africa, sanitation infrastructure is limited. Consequently, the virus is everywhere in the environment. Up to 90% of people are infected by the time they are 10 years old.
And because they catch it as children, their immature immune systems handle it easily, and they gain lifelong immunity.
Exactly. The biology supports that. But in low endemicity areas like the US and Western Europe, our water is highly purified. Most people never encounter the virus as children.
Which introduces a deeply unsettling paradox about our future. Are you saying that our own success in cleaning up the world's water and sanitation is secretly building a powder keg of vulnerable adults?
Unfortunately, yes. As global sanitation continues to improve and more nations move from high to low endemicity, fewer children are getting that mild natural exposure, we are inadvertently creating a massive global population of susceptible adults.
Wow.
Adults who, if the virus does slip through, will face the devastating T-cell immune response and acute liver failure we talked about.
It really forces you to confront the reality of public health progress. Like, by cleaning our water, we trade widespread mild childhood illness for the potential of catastrophic, localized adult epidemics.
Exactly. We can no longer rely on dirty water to silently immunize our populations. We must actively close the gap with comprehensive universal vaccination programs, or we literally leave millions of adults completely defenseless.
And that vulnerability takes on a terrifying new dimension when we factor in the changing climate. As extreme weather events and severe flooding become more frequent, modern municipal sewage systems in previously safe, low-endemicity cities are increasingly at risk of overflowing.
It's a huge concern.
If floodwaters carry raw sewage into the streets of a city where the adult population has zero immunity, we are looking at the exact biological powder keg that caused the 1988 Shanghai disaster, but on a much wider scale. We might be cleaning our water, but the climate may decide to mix it all back together.
That's exactly what keeps public health officials up at night.
Stay informed, stay prepared. This has been Outbreak Brief.